Good evening, everyone. Welcome to Turn Left. I am your host, Indiana's own Dana Black. Wow, what another fantastic and exciting week. When I first started this show, I was curious about, how I would find topics to talk about. But our federal government right now continues to give us new and inviting and exciting things to talk about on a daily basis. But we're not going to spend a lot of time on the federal level today, but we're definitely going to spend some time talking about our health care initiatives today. Because the CBO came out with their report today, so we're going to talk about that a little bit. But first, you know me. My goal is to get you guys engaged and let you know what's going on in the state of Indiana, around town, with events that are happening from the left side of things. So let me share with you first and foremost my announcements, and then I will introduce my wonderful guest and my friend. So this should be fun because she's my friend. You know what I'm saying? So the conversation might get a little heady. All right. On Saturday, May the 27th, in Columbus, Indiana, the Black Lives Matter of Columbus is hosting a Fix the Pipes rally from Michigan. So listen, we all know that Flint, Michigan is still struggling with water. They don't have clean water yet. They haven't even, the governor is getting away with poisoning children and families. They're having a rally for them Saturday, May 27th, starting at 2 p.m. You can meet them at the Columbus City Hall, 123 Washington Street, Columbus, Indiana. If you're down south and you don't have a whole lot going on, visit the rally, support Black Lives Matter, because you see they're out there doing their thing. They're out there making it happen, and they're bringing awareness to issues not just in Columbus, but things that affect all communities. And clean drinking water is definitely something that is going to affect a lot of people. So I told you guys that we were going to be having some candidate call-outs and some candidate training. I have information here from the Hendricks County Voices for Change. They have an initial candidate call-out on Wednesday, May 31st, from 6 to 7:30 p.m. They will be meeting at the Avon, Washington Township Public Library, 498 North Avon Avenue in Avon, Indiana. So if you're interested in running for office, here's a group, Hendricks County Voices for Change, that is looking for some good folks to run for office. They're probably going to share a lot of information on how to run and what that information looks like, and how to do the do. Southside Democrats pancake breakfast with Prosecutor Curry. Marion County, if you've not had a chance to meet your prosecutor, you elected him, you voted for him. He's going to be at the pancake breakfast on Saturday, June 3rd, from 9 a.m. to 12 p.m. and it's at the Southside Club over in Fountain Square. I'm sure there's a minimal charge for the pancake breakfast because I'm sure it's a fundraiser. But if you're still interested in getting involved, here's an opportunity. There's going to be some good Democrats out there. The Southside Democrats are always on point. Larry's going to ask you for your donation. He's going to ask you for your dues. Did you pay your Southside dues? So you might as well go ahead and bring your money. He's going to want that. IDAC meeting, Saturday, June 3rd, from 11 a.m. to 12:30 p.m. at the Julia M. Carson Center, 300 East Fall Creek Parkway, Indianapolis, Indiana. Now listen, IDAC, Indiana Democrat African American Caucus. A lot of folks are always talking about black folks don't get involved. Well, here's a whole organization designed to make sure that black folks have a voice. They have their meetings, I want to say every fourth Thursday or fourth Saturday. So be sure to join them if you want to get involved and you have a certain desire to make sure the African American community is represented in the Democrat Party. This is an organization that you need to join in. The state IDAC actually has a voice and a vote on the Central Committee. So what your concerns are, you should definitely get involved with this organization. So check them out. I hear you, Carla. Pay those dues. Indivisible Indianapolis monthly meeting, Tuesday, June 6th, from 5:30 to 7:30 at the MCL Restaurant, 2370 West 86th Street. I'm throwing this plug out for Indivisible Indianapolis because I will be their guest speaker for this meeting. I'm excited about that. As part of my duties as the Deputy Chair for Engagement, I am trying to make sure that I involve myself in all these organizations that have started up and see how we can work together. Not asking to dissolve them, just want to see how those organizations can work with our Democrat Party here in the state. I'm looking forward to that, given an opportunity to share my story, take some questions, and recruit people to either run for office or become good volunteers. We need all of that. So see you June 6th. Pike Township Dim Club meeting Wednesday, June 7th, 5:30. They run a tight ship over there. They have a good club. You should definitely go visit them. Pike Township Government Office, they meet once a month as well. And then I'm really excited to share this. This is something that I did in 2015. And it really, really helped me out as I was running for office against Brian Bosma. A 2017 candidate school hosted by the Hamilton County Democrat Club. I'll be honest, the first time someone sent me information to go over to Hamilton County to learn how to be a good Democrat, I scratched my head and was asking them, are you really sending me to Hamilton County? But that Democrat club and the women's club, they are very active. So they are going to have a candidate training school at the Hamilton East Public Library in Noblesville, June 10th from 9 a.m. to 3 p.m., One Library Plaza, Noblesville. This school, taught by local Democrats who have run for office, covers all the basics of how to be a candidate. All the nuts and bolts will be covered, the legal paperwork needed, campaign fundraising and campaign finance reports, because you don't want to go to jail. You don't want to go to jail. You want to run for office, better learn this stuff, right? What signs and handouts you'll need, how to go door to door, and much more. This is an amazing, amazing event. I was there. These guys know what they're doing. They're not going to steer you wrong. It helped propel my campaign. It gave me the advice and the tools that I needed to run a professional campaign. So if you're really serious about running for office, and even if you haven't decided what office you're going to run for yet, this is a great opportunity to learn about how to be a candidate. Honestly, there's more than smiling and shaking hands and kissing babies. There's a lot of work that's involved. I also know that they'll probably teach you about some of the data stuff that goes along with that. Running for office is serious business, and if you really want to represent your community, you need to know how to do it the right way. So those are my announcements for the week. A lot of stuff going on. So I want to give a shout out to the group that showed up Monday to picket, and I like that word. I'm going to use that, picket. Betsy DeVos, as she came in town touting her, I'm going to cut all public school funding, and I'm going to cut funding for HBCU's program that she has. Betsy DeVos is a scary person to be in charge of our education. I am not a fan of Betsy DeVos. You all know this. Her whole goal is to make sure that we take money out of public schools and funnel that money to private schools. She's been testifying in front of Congress. You guys should listen to what she says. She can't even answer whether or not it is okay for a school that gets federal vouchers to discriminate against anybody for any reason. Meaning, if a school says they don't want black kids there and they can get federal vouchers, she may not oppose that. Or gay students, or if you're a gay parent and you are parents of a child, they may say, no, we don't want you in our school, and they will still be able to get federal funding. I have a problem with that because they're using my gay tax dollars or my black tax dollars to pay for these vouchers. So we need to stay vigilant and not allow this stuff to continue without us showing up and showing out in force. And I got to give it up to the crew that showed up last Monday night while she was giving her speech, protesting, and all that good stuff. All right, so I know you guys are sitting here going, well, who is the chick to the side? Please let me introduce you to my good friend. She's been working with me over the last 2 years. She was one of my, we learned a lot from each other, and she, helped me on my campaign, being just a good ear. Sabae Martin, you've probably seen us out and about together. We've gone to council meetings together, and we do a lot of stuff in the community together. But today we want to talk about sickle cell, because they have a lot of stuff going on, and the Martin Center Sickle Cell Initiative, they have a lot of events going on in June. And I want her to explain, what sickle cell is, if you guys are not, familiar with it, what the Martin Center does, what the initiatives are all about. And then what we're going to do is we're going to tie that in to the CBO healthcare report that came out, because this is a political show. My show is political, and this is what we talk about. So I'm not going to, I want you to just, first of all, thank you for joining us. I really appreciate you coming and taking the time out of your busy schedule, sickle cell warrior. I learned that term over the weekend as I was doing my research, to come and sit down and talk to us on Turn Left. Tell me who you are. Tell me why you're involved with sickle cell and the Martin Center.
My name is Sabae Martin. I am an executive board member for the Martin Center Sickle Cell Initiative. I am the treasurer. I came to the Martin Center from an experience I had with a family member who has sickle cell. Sickle cell disease is where the blood cell, the regular shaped blood cell, which is an oval to circle shape, actually sickles, and the sickling can cause crisis. And that's why we are warriors and we're fighting to help and to bring attention to sickle cell. So, sorry about that.
She getting phone calls on my phone. I'm gonna need you to put your phone on mute.
Yeah,
on silent.
I thought I did. Excuse me. Sorry about that. This is a live show.
Live show.
Live show.
Live show. This
Okay.
is not
So,
limericks.
Anyway, sickle cell disease is very important, and I'd like to clarify one thing before we move forward. Sickle cell disease is primarily a part of a disease that affects the black community, but it is not only the black community. What we have learned since sickle cell was discovered 110 years ago is that primarily it does affect the African American community. However, in that 110 years, and the reason that I mention that and the reason that I'm happy that we're going to talk about the CBO report is that funding affects how we can treat it and how we can find a cure for it. I said to Dana earlier today that we should look at the effects of sickle cell like we do cancer. You don't come to it with color in mind because you can't determine how you want to help someone or give to a cause because they look like you or they're in your peer group.
Right.
So we want to take into consideration that the Martin Center has been it was established 50 years ago.
Okay.
We are having our 21st our 21st walk in June on June 24th.
June 24th.
Mark
it down.
That is our major fundraiser for the year, but it's not our only fundraiser. We have a Zumbathon that's going to take place on June the 2nd. We're very proud of that. And June 16th, we have popsicles on the circle where we give away free popsicles down on the circle to promote the walk, and then of course the walk on June 24th.
Okay.
My job as the treasurer has become to build relationships and partnerships to help bring people to the cause of sickle cell, to help us raise funds and to support what grants and other funding don't cover.
Okay.
And that leaves a great deal of things that need to be provided. The Martin Center provides bus passes, we provide food pantry, we provide the human aspect of what's needed for sickle cell patients, and we also provide psychological counseling because sickle cell is a very difficult disease. I've heard people who are warriors, the true warriors, say that it feels like someone has taken gasoline and poured it on their muscles, and what causes a sickle cell crisis is where the sickle cells actually clog together like a traffic jam.
Okay.
You're going down the street and traffic is moving fine, and then you get to a traffic jam, and what you could see from above would be the jam and no traffic on the other side.
Ouch.
That's the crisis. Because if you can't get blood and oxygen to your tissues and your muscles,
that's going to cause some major
problems. It's going to cause some major problems.
So I assume then the sickle cell is a hereditary disease that is passed down from generation to generation. So a person is actually born with this disease.
And that's why one of the things that the Martin Center does and many sickle cell initiatives is we do newborn screening to try to give that information to parents, and so that people know as they grow up that having a trait and matching with someone else that has a trait can cause some difficulties in a union.
And I actually read where, because I try to make sure that when I'm talking to Sabae, I know my stuff, because she gonna check you if you don't. I read where they can't actually test for sickle cell in the womb because it doesn't present itself until after the child is born and maybe 4 or 5 months into their life. And then that's when they notice it with the swelling of the hands and things like that.
Those things are that is true.
Okay.
And those things are not always readily noticeable.
Okay.
I'll put it that way. You don't have all of the symptoms in all of the people all of the time.
Okay.
And that's why I likened it.
It's different like everybody else.
It is different like
Okay.
everything else, like everybody else. But that is exactly right. And it's very painful. And one of the things that concerns me the most, or what drew my passion to the sickle cell issue, is to see young children under the age of 5 that actually suffer strokes because of sickle cell. When you have a crisis in your brain or in your chest, and you can't get blood to the organs that are necessary, blood that's necessary for all of our organs, there's no age limit. There's no how young you can be. There's not an age limit on how old you can be. But just to imagine a child that's age 2, 3, 4, 5 to have a stroke is just heartbreaking.
I imagine it is, and as a parent, it's got to be incredibly frustrating. So, I want to. Gosh, that's a lot of information that we just kind of talked about from a health aspect, and I love the community aspect of the initiative. Is this something that is a national initiative where there's local chapters? How does that work?
Yes, there are. There are chapters all over the United States, some larger, some smaller, and then some that are very small. But it is a national effort to try to address sickle cell. Our corporate office, if you will, is in Baltimore, Sickle Cell Association of America. We're very proud to partner with them when they come here in September to have a conference. And yes, to answer your question, there are sickle cell initiatives around the country.
Okay, and so you guys have essentially a national network, and
Yes.
then basically everything filters down to the communities based on the community needs.
Yes.
Okay,
Yes.
That's excellent. So how can someone, if they find themselves in need of some assistance, how do they reach out to the Martin Center? Do they have to sign up? Do they find out about them when they're in the hospital? Because I know with a disease that is a chronic disease like this that is going to be with you throughout your whole entire life, that the hospital system and the medical care system is going to offer resources, right?
Well, I said earlier that I came to this cause because of a family member's challenge. That challenge happened at a local hospital. She was in crisis and was there for 6 to 8 hours without receiving anything for pain. And again, I said the pain of a sickle cell crisis is like none other.
Right.
It doesn't register on the chart from 1 to 10. It doesn't register as regular pain. But she was at the facility where her hematologist was, where her OB-GYN doctor was, where all 3 of her children were born, where all of her records were, but they said they had to talk to the doctor before they could treat her.
Oh, wow.
And so the reason that it became a passion is because you could obviously see that the attention wasn't given as it would be if that person came in with a heart attack,
right,
or with pain in their abdomen or pain
right,
in their chest. We are working to try to establish a protocol in emergency rooms that will allow better care for patients. But yes, around the country, we share information. We try to.
Okay. And what's the research like for sickle cell? What kind of investment have either pharmaceutical companies or the medical industry? What kind of investment are they making into help find solutions, maybe treat the symptoms? What's out there? In
the 100 plus years since sickle cell was discovered, there has not been one meaningful medication that you could get a prescription for. There is one medication that's widely used, the common treatment, and I'm not saying in every case, but the common treatment is blood transfusion.
Boss came in. Boss always comes in the middle of the show, and all the ladies be like, "It's HB." I'm just teasing.
No, she knows. Hey, boss. It is what it is.
The boss came in. I'm sorry. Go ahead. Back to the medication.
That been in 110 years, more than that, there has not been a meaningful medication, meaning that your doctor, you could go to the emergency room, go to a doctor, like you could for high blood pressure. You get hydrochlorothiazide. For diabetes, you get insulin. For other diseases or concerns that you have medically, there's usually a readily available solution. Not for sickle cell. The some of the causes or some of the reasons that we've heard has been that the number of people that have sickle cell is too small to warrant the cost of developing the medication. But there are some companies that are working on it right now. We're very, very happy that there may be one or two companies that are finally looking into a medical solution.
Wow. What I just heard you say, and I'm going to repeat this because I want people to understand the impact of the decisions that are made by pharmaceutical company CEOs, people who typically do not look like us, that there aren't enough people who are suffering to make the proper monetary investment to find relief for these people. And I don't mean that in a disparaging way when I say these people, but when we know that 95% of our CEOs, especially in the pharmaceutical industry, are white males. And so you have a group of people who have basically said, you wouldn't make us enough money, so we're not going to invest any time or energy into developing something for you to have an improved life.
Well, since I'm sitting here with my friend Dana Black, let me go ahead and say this. The other concern that we have is the history of the medical profession with African Americans, the Tuskegee experiment, and some other things, the Henrietta Lack story, some other things that have occurred that don't foster trust in participating in research studies.
Okay.
So there are some issues on our end that we need to overcome. However, if there were enough dollars in it, we know that corporations will find a way to make that money. And so the bigger problem with not having treatment or a cure is that we feel that I feel that it is an African American problem and not enough people suffer with it to warrant the investment in treatment or cure.
And I've not ever seen like the movement that the HIV/AIDS crisis started. So when the HIV, now let's be honest, the HIV/AIDS crisis that hit the LGBT community predominantly hit white males.
Yes.
And so they did their thing and said, hey, government,
yes,
where are you on getting us some medication? They pushed until they, kicked the door in. Has there ever been like that type of movement from the sickle cell community, sickle cell?
We are trying as we speak. In this year, we have been trying for the past 4 years to raise awareness, to put a light on sickle cell, to bring more ears to the cause. Like I said earlier, with other fundraising efforts, and I can say the cancer fundraising effort, people come to it to help those who are suffering with the disease. They don't say, well, that's just black people, or that's just Asian people, or that's just gay people. They say those people need help. We need help. And so in order to get the help, people have to know. And we're trying to raise awareness as well as raise funds. Okay.
So you're probably asking yourself, well, I know there's a political spin on this somewhere. So, I want to make sure that I provide good information. I am not an expert on anything. I just read a lot. So what I wanted to do before Sabae came on the show is I wanted to do some research and get some numbers on what it is like, because patients are in chronic pain with sickle cell, and it actually limits their ability to work.
Yes.
And that means that their income levels are lower.
Yes.
Because they can't work because they have these crises. They may have a job. Some employers will be understandable. Others may not. Sure. And if not for possibly the FMLA, in many cases they wouldn't be employed, depending on how their sickle cell is managed and how it resonates inside their body. So I wanted to get some information on what it's like for a patient and how much it costs to actually be a sickle cell patient. But the last research documentation was done by a Dr. Teresa Koff at the University of Florida in Gainesville in 2009.
Yes.
So in 8 years, there hasn't been any significant research on the effects economically on people who suffer with sickle cell. But I want to read what that 2009, I know this, I try not to go back that far. I couldn't believe it. I thought maybe I was missing something, and I even went to the site to see but this is the last report, right? So, in the 2009 study shows that an annual cost of medical care in the U.S. for people who suffer with sickle cell disease exceeds $1.1 billion. So, collectively, everyone in the country who is dealing and fighting this crisis and trying to have some normalcy in their life, it's costing $1.1 billion. Total cost per patient per month were highest in adults, peaking at $2,853 per patient per month, and patients aged 30 to 39. And then the lowest were children from birth to age 9, where it was $892 a month. So an infant who has developed sickle cell is going to cost their family in medical expenses $892 a month, $900 a month.
Now, I just want to interrupt you
Yeah,
here. Now,
go.
take those numbers from 2009.
Hello.
And
Inflation.
inflate those numbers.
Inflation, right.
Inflate those numbers, and then look at where we are today with what they're attempting to do with the Affordable Health Care Act.
Absolutely.
There was some relief in what we experienced with affordable health care.
Okay.
That is changing, and the numbers that we're looking at are close to 4 million just in the state, 40 million in the state of Indiana.
$40 million for patients with sickle cell in Indiana alone.
They're just starting to track some of those numbers in hopes that the argument becomes we need to have more funding coming from the government to help people address these issues. And we need specific, and that's the other thing we're really working on. Gary Gibson, our CEO and president, hey Gary,
give him the shout. Hey Gary.
Hey, is working very hard and in discussions about hopefully having sickle cell specific medical centers where people who are trained to deal with sickle cell can go and not go sit in an emergency room just to be turned away a lot of times without the care that they need to have.
Right, just like cancer centers or even maternity hospitals, just where it's specialized.
Yes.
And you have an oncologist that takes care of your cancer. What is the sickle cell doctor's name? Do we have a name?
There is not one specifically. There are no doctors that specifically specifically specialize in sickle cell disease, and so that's what we're trying to show, or what we're trying to show is that if there were centers like that, you could cut down on the cost because you're dealing with people that are well versed.
Yeah, absolutely, and they're focused in on, and they are more apt to recognize certain issues that come about from sickle cell patients that may not present itself that the regular doctor may not be able to just pick up on.
Yes.
And those are, that's so key, because the time it takes to diagnose your issue, you could be in crisis for a very long time without anyone actually being able to recognize what the problem is because they have not been specialized and trained to look for those things.
We can't even start that conversation in this brief show.
We got an hour.
At advocacy training last week, I learned that there were fewer doctors in the state of Indiana that know about sickle cell that you could ever wish for, and I won't go into that small number, but I do know that they spend a total of 1/2 day in their medical training learning about sickle cell.
I'm sorry. So you just told me that a disease that we diagnosed in the African American community over 100 years ago and causes chronic pain, causes people to lose time from work and their livelihood, to have a meaningful life, they spend 1/2 day learning about the disease. That's a travesty. I didn't know that. You should have told me that earlier. Then me and you could have really had a serious conversation about that.
We can have more conversations.
Oh, absolutely. But we're going to. So I want to read a little bit more. On an annualized basis, now mind you, these are numbers from 2009. On an annualized basis, the total cost of care ranged from $10,704 for children aged 0 to 9 years to $34,266 for the age 30 to 39 group. And what she says in her report, what Dr. Teresa Koff says in her report, for an average patient with sickle cell disease reaching age 45, total undiscounted health care costs were estimated to reach $950 $53,640. And roughly 80% of those costs were associated with inpatient care. 3.2% of those costs were associated with emergency department use, 0.9% with physician visits, 3.6% with prescription drugs. The remaining 11.7% of the costs are from other care, including home health and nursing care. So the fact that 80% of what a patient spends on care is actually inpatient care is a clear indication that we have not developed as a developed nation the tools by which folks would be able to treat themselves and not be in the hospital. I mean, only if you think about it, only 11.7% of all the money is for, and part of that is divided up between home health and nursing home care. Sure. That's when they probably gotten to a point where they can't get out to the doctor anymore.
And that those numbers have changed over the years, and they have to keep in mind that those are old numbers.
2009.
So 2009, and so you have to stop and ask. If you want to know what the problem is with treating sickle cell, you have the answer in the fact that there's been no research since 2009.
That isn't. We have developed erectile dysfunction medications about a dozen.
Yes.
We know
and
how.
And made them available.
Right, and they're not even considered a pre-existing condition, by the way.
I wasn't going to bring up that phrase when it comes to sickle cell.
Yeah, sickle cell, that is a pre-existing condition because it is a trait that you were born with.
Yes.
And so when we talk about, let's spin it, baby, the CBO came out. The CBO came out with their report today on the impact of the GOP's you don't get any health care bill. They call it a health care bill, but it sounds like, they want to take us back to the Stone Age where you went out and conked your wife over the head, drug her back to the cave, and then you would hope that a dinosaur didn't eat you in the process, because they don't care if you have health care or not, because all they really care about is the tax cuts that they're giving to the wealthiest 1% in our nation at the expense of all of us. Now, I say it like that to say this, and we're going to get back to it. We are in control of this.
This is true.
We have the power of the vote. We don't have to keep electing, congressmen from Montana who body slams. I was going to throw that in there, right? He body slammed the reporter. Yes. I thought it was really cute how the reporter was like, I'm calling the police. And I'm like, on the Congress, I'm calling the police.
I thought it was really cute that a Fox reporter said,
no, that didn't happen that way, right?
Yeah.
So here we have, these guys are working diligently day and night to create more economic disparity, education disparity, healthcare disparity, and we have the opportunity to fix this. Don't think that elections only matter in 2020 every 4 years of presidential elections. These midterm elections have a greater impact because think about it. The House is elected every 2 years. Mm-hmm. Every 2 years. So in 2018, Susan Brooks, who voted for this bill, is up for a vote. And all the other 9, we have 9 in the state of Indiana. They're all up for a vote in 2018, and all of the Republicans in Indiana voted for this bill. So let's look at the highlights. I had to, I had to get ready to read it because I knew when I was going to read it I was going to be not a happy camper because this is a joke. This is a joke. First and foremost, what you must understand, the health care plan will leave 23 million people uninsured. This is not an assumption. This is what we know. The reason why, we'll go down why, but know this. The fact that they're cutting funding, they provide subsidies and help to people to find affordable health care is getting cut. So 23 million people will be without health insurance. Many of those folks will be individuals who can't afford health care because they have crises with sickle cell and they don't have the same earning potential. Now, I'm going to say this because I can't help myself, I'm black. The assumption is that black folks are lazy. We know that assumption. We know the assumption is as Democrats, we're waiting for the handout.
Of course.
And if we have a disease that is attacking predominantly African Americans, the assumption then is that these folks are just flat lazy and don't want to work, and we don't want to help them. And this is the premise that they're giving folks in the real world. Come on, jump in.
I would just think that there's enough probable cause to call that a crime because since sickle cell was discovered 110 years ago, there's not been any care or concern dedicated to sickle cell. So why would there be tax dollars, medical dollars? And when you mention the children, I think about it's hard enough to find daycare for your child, but it's even harder to stay home with a child because you're the only one that can give the appropriate care for that child, and you can't work.
Right.
That is in a crisis, and when you take that child to an emergency room, probably they will not receive the appropriate care that they need.
So let's talk about there will be 14 million people that will no longer be covered under Medicaid. Well, if you're not working and you have a child that is sick,
exactly,
Medicaid is that supplement that helps get you through.
Exactly.
And this plan that the Republicans are so happy about, that they had a cake party about it when they passed it. They had a cake party.
Get out.
They had they brought beer in to
out.
celebrate passing this bill. Cake party.
Get out.
And check it. The photograph, I don't know, I posted it on my Facebook page, but the photograph was all of these white males.
Oh, yes.
White males. There were I would have been happy if you would give me at least 5 women. You know what I'm saying? So that we can at least have some voice.
That's when America was great.
Oh,
again.
Girl.
Yeah.
It will reduce the debt. Now, they say that it will reduce the deficit by $119 billion over 10 years. But that's at the cost of 23 million people being able to get adequate health care. The CBO score report says that changes coming in the GOP health care bill will hurt older people with low income the most. Let's just stop right there for just a second. I want to highlight that for just a second. The elderly. Are we expecting them to get out and work 40 hours a week anymore, Sabae?
Well, no, and the harmful thing about not treating sickle cell, besides the pain, is that there is a shortened lifespan for many sickle cell patients. So not many sickle cell patients get to be elderly.
Wow.
So
because we haven't done any research to figure out how to extend lives.
Nothing has been done to do that.
Well, I'm going to touch on this for just a second.
Do.
Because the idea that this bill will hurt the most vulnerable among us the most is a crime. And we ought to be ashamed of ourselves. I'm a big Morning Joe watcher. You guys know it. And Barnacle, one of the commentators on there, was talking to a senator this morning. And he asked the question, when you're sitting with your Republican colleagues, do you ask them how they were raised? This is how deep it has gotten. They're literally going, what are you thinking? How can you come up with an idea that hurts the most vulnerable among us? Now, they were talking about the Trump budget, to be more specific, because that thing is ridiculous, and I'm going to talk about that next week. But the fact that we're saying that we're going to hurt older people with low income. So wealthy people who are generationally wealthy and have lived a long life and are hanging out in Saint-Tropez or the Canary Islands on their yachts, they will be able to get good health insurance. But grandma, who raised 6 kids and is doing the best she can and helping out with a couple grandkids, may have some kids who got caught up in the opioid epidemic and raising, other kids. These folks are the ones that are going to be hurt the most. All right, let me keep going. It will also cause premiums decline as less sick individuals sign up for insurance under the bill. So the whole premise of the ACA was everybody contributes.
Right.
If everybody contributes, then it'll bring the cost down and we'll have enough for everybody. But if young, healthy people don't actually get involved and contribute, like, Social Security.
It's lopsided.
It's lopsided.
Yes.
And it's not, and see, gosh, we are so short-sighted in how we see things. The idea that we think, well, I don't want to pay for somebody else's insurance, somebody's going to pay for yours.
This is true.
Somebody's going to pay for yours. When you can't work or, heaven forbid, something awful happens and you become disabled, somebody's got to help you.
Well, you know what this part of this conversation reminds me of? The scary stories that they told about Obamacare and the death squad.
Death panels.
The death, all of the bad things are going to happen under that plan. Well, look what's happening now.
Oh my goodness! So this is worse,
Possibly.
right? There's also the possibility the GOP healthcare bill will destabilize insurance markets in certain states. So in some states they're stable, in other states they're not. This bill will definitely cause some havoc. However, some states may choose to sign up for waivers that would eliminate many of the Obamacare rules. Let's go back to that.
Yeah.
Let's go back to that, because this is where it all comes together with our sickle cell conversation today. One of the key components of the ACA was an insurance company could not turn away individuals with pre-existing conditions, nor could they put them in these high-risk pools where their premiums went through the roof.
Sure.
That was the whole point of being affordable. So if everybody contributes, the person that needs health care can still contribute, but won't be put in a situation where they had to give so much they had to choose between medicine or food, or medicine and a roof over their head. The fact that states could opt out of certain aspects of the health care means that if Mike Pence were still governor, and blasphemy, I say, I've just uttered blasphemy. Just like he did not want to do the pre-K grant, he could have said, well, we're going to pass on all those waivers, and the wealthiest among us who can afford a little bit more, you're going to be able to keep all your money, and sick people, hope you got friends, because that's what it all comes down to. There's no government. Again, I've said it 100 times. Government is about making sure we take care of the people. I understand corporations are in business; they invest their money to make money. I get that, but it's the government's job to make sure those businesses don't harm us, and the government takes care of its people, not necessarily giving them handouts.
True.
That's not what I'm saying, because I don't mind, but if I contribute, I won't. Don't tell me. I hate it when they call them entitlements.
Right.
We need to reform entitlements. I don't want to hear that. I'm paying into it. How is it an entitlement when I'm ready to collect?
Well, just the way you can't exclude someone from coverage, but now you can file for a waiver.
You can waiver. You can't exclude, but we're going to waiver you out. All right. The CBO score report says that the states, for about half the population, will likely take these waivers. So the assumption is, based on this report, that many states will actually opt out on many of the coverages that are available to them. This is scary.
It is.
This is very scary. The new bill will also allow states to get waivers so that insurers can charge more based on pre-existing conditions. All right, we're going to turn this back to sickle cell now. You and I, and with you eloquently explained to us how sickle cell, how the disease manifests itself in the body.
Yes.
And we've come to the conclusion that we know that if mom and dad both have that trait, more than likely you are going to be born with. And those symptoms show up at 5 months old or younger, or maybe a little older, depending on the person. But it is established long before you have an opportunity to do anything.
Yes.
We also established that from a 2009 report, and you guys can calculate the inflation, that the earning potential for individuals with sickle cell diminishes because of the health crises that they find themselves in at no fault of their own. Not like they got up and decided to, go smoke a crack pipe, or they decided to go up and make some meth. This is a situation where, because the opioid addiction is real, and everybody wants to invest money in opioid addiction, and yes, it's a bad thing, and I'm not saying that it's not, but geez, here are people who were born with a disease, and they can't get the same help or the same attention that the folks who are on opioids and having an addiction get. I just wanted to throw that out there. That was a moment. I have those every now and then. If you've seen the show, you
great. Yes.
Yes, because that's real.
That is very real.
That's very real.
You're at the bottom of the consideration pot. When you are just a non-entity, it's very difficult to see these cuts coming. We have no idea how they're actually going to affect a very bad, very strained situation, but we know that it won't make it better.
And so it just disturbs me that they talk about the premiums will go down for the insurance. So, I found a little chart because I want to make sure whatever information that I'm sharing on Turn Left, it is as accurate as I know it to be and what the research tells me it is. So about 1/3 of the U.S. population will reside in the states requesting moderate changes to the Affordable Care Act regulations. So under the Affordable Care Act, if you were age 21, you would pay about $17,000 estimated annually for your premiums. Age 40, about $17,000. Age 64, about $17,000. You see how that works? So at 21, you probably won't need as much health coverage. At 40, you may need a little bit more, and definitely at 64, you're definitely going to need a little bit more than you did at 21. Some people are like healthy and they don't need anything, but at 64, more than likely, you're going to need something. But the thing is, you've been paying into it since you were younger, and that pot continues to be there. With the May plan that the Republicans came out with, if you were age 21, you will pay actually slightly more, set $1,750. But if you were age 40, you would pay $2,900 annually. And the part that is heartbreaking is if you're 64 years old, under this new health care plan that Republicans are touting that America really needs and it's going to make America great again, if you were 64 years old, your annual premiums could reach up to $16,100.
Wow.
Let that sink in. Let that sink in. If states decide to opt out of some of the waivers, the cost goes down a little bit, but it's still crazy, right? So if you're age 21, you pay $1,250 if the state opts out of those waivers, get those waivers. They pay $1,250. Age 40, you pay $2,100. At age 64, you're still paying annually for premiums $13,600.
But only if you're not waived.
Right. Now, let's forget the waiver numbers, right? Let's forget that. Let's go back to say the state doesn't take those waivers. Mm-hmm. And everybody has to contribute. That means the younger people will have to pay a little bit more. The elderly are still paying $16,100. I know at 64, unless you invested well, unless your parents left you a gang of money, you hit the lottery and didn't spend it all, you were a professional athlete and made millions over the years, or you were a Lilly employee and you retired with a nice parachute package, $16,100 is going to be a significant portion of your annual income that you receive, because guess what? You're not working. Usually at 64, 65, 67, and imagine if you're in the 67-year-old to 70 range, your premium's going to even be higher. Right. And you're not working because you've retired. How can a person afford that?
Most people don't get that much in total Social Security if they don't have a pension. So they're already in trouble.
Folks.
And that's someone that doesn't have sickle cell or doesn't have cancer, doesn't have any of the other
or any other chronic disease. Chronic disease, or something that requires constant medical attention like hemophilia or something of that aspect where you need constant medical care on a regular basis. High blood pressure. Let's talk about meds. No, we're not going to talk about. We're not going to talk about the pharmaceutical companies right now. I mean, I know that you're in business to make money. But, the EpiPen going up 500%. Come on now. Yeah. Come on now. You already know that was crazy.
Yes.
Because the focus is where is our humanity? And so when Barnacle asked the question this morning, how were they raised? Because it was so hard for this East Coast man who was a journalist to imagine people coming up with plans as humans, other humans, people that they know that look like them, come from their community.
Right.
Could come up with plans
that were going to harm people,
that were going to harm humans in that way.
It is a moral issue.
Absolutely. And they always say that the budget tells you where the moral compass of the administration is. Republicans, you say you are down for everybody having an opportunity, but I don't understand how this right here gives people an opportunity when if they have, you're basically saying the most vulnerable among us, you don't matter. The young, you don't matter. They're cutting funding for schools, and if you're young when you're born with something that is going to cost some money, you don't matter. Elderly, you don't matter. Those of us who know people with autism who live long lives, you do not matter to the GOP.
No.
You don't matter. Because they continually find new ways to harm humans, their fellow citizens. We don't have to take this, Sabae, do we?
No, we don't. Because there's something coming up in 2018 called a what?
An election, baby.
Yes.
An election.
Yes.
So I felt like in order to actually have a real conversation on healthcare, you needed to apply, how it impacts our lives. Sometimes people don't understand how politics and the policies that are passed by our elected officials impact our lives. Mm-hmm. Black folks, this show is really talking about, I'm talking to you. I'm talking to you because sickle cell impacts our community at a much larger rate than any other race on the planet.
Even if it is found in other races.
It is found
in other races. However, the predominant race is African American.
Absolutely. And we want to talk about, what the party looks like and who's involved in the party and they won't let me in and blah, blah, blah and all of that. I'm not buying that. This is where we need to stand up for ourselves. And just like the LGBT community did in the 80s when they were afflicted with HIV and the AIDS and how that was killing them,
yes.
Left and right, they made a quilt. They put a quilt in Washington, D.C. and said, know us, hear us, see us. Black folks, the elected officials that are in Washington who are determining what health care you deserve and the people around you, you can have an impact. Get involved. Do you know about Marion County Democrat Party? You ain't even got to lead a city. I often, every week, talk about a different club that is doing something around the city. You ain't got to even lead the city. If you're in Lake County, if you're in Allen County, if you're in Kosciuszko County, Fayette County, there are places where you can get involved. Clark County, Vanderburgh, I'm calling them all out, right? Because we can't continue to sit around and talk about what's happening to us.
No. If
we're not willing to get out there and fight for us. If we don't fight for us, what makes you think they want to fight? Well, you're not doing anything.
This is true.
So sickle cell, Martin Center Sickle Cell Initiative is one of those things where we're saying we're going to take our community back.
We are. We're lifting the cause. We're putting light on it. We're drawing attention to it. We're informing people. And we're educating people. So
drop those dates again for the events that you guys are having. I know you guys got one coming up like next week, the Zumba
Next week is the Zumbathon. It is going to be on June 2nd at Barnes United Methodist Church.
Okay.
It's on a Saturday.
What time?
From
so
10 to 12. Classes every 30 minutes, so they have 5 instructors. A very exciting time. This is our 4th annual Zumbathon.
Okay.
Very proud of that. And then we also have our 2nd annual, because I said we're trying to increase our fundraising efforts. Our 2nd Popsicle on the Circle. It is not a fundraiser. It is a celebration that leads up to our largest fundraiser of the year, which is the 5K. If you run, if you walk, if you walked in the Komen walk, kidney walk, any other walk, please come walk in our walk.
All of us.
5K walk, run, and it is June 24th. It starts at 8 a.m., and we're usually done by 9.
I did it last year, and I'm a bariatric patient, so the idea that I walked 5K after carrying around 307 pounds, I was excited about being able to do it. I accomplished it. I wasn't a winner, but I did it.
Oh, but you were a winner because you did it.
I would do it this year, but I'm not going to be here. So, but listen, this is a good cause. And you see, if we don't take care of ourselves, nobody else will. And we have to hold ourselves accountable for how our fellow man exists on this planet, in our state, in our communities. You may not know anyone with sickle cell. You may not know anyone with cancer. You may not know anyone who's suffering from Alzheimer's. But if there's an opportunity for you to give back, be it a volunteer, because I know you guys are taking volunteers.
Yes, we do need volunteers, absolutely. You can go to www.themartincenter.org and register for volunteers or to walk.
Okay. So there's opportunity, ample opportunity to get involved. Each one teach one. I love the fact that you came on the show and you shared a lot of fantastic, positive information. You know, on Turn Left, there's always a political spin. Please know that this health care bill is going to hurt us as citizens of this great state, and this country, right? Even 45, the orange one, told Australia that their health care plan was fantastic and way better than ours. I know Bernie Sanders is like, oh, we're going to talk about this on the floor. I mean, we have this person who has no sense of tradition, no sense of our history, and no sense of community.
Sure. Yes.
No sense of community what it means to be a nation of communities, leaning on each other, helping each other. And that's what Indiana's Own and Turn Left is all about, is what is it that I can bring to help my community? I got this thing. You have the Martin Center, and you're doing fabulous work. If y'all don't know Sabae, now she will argue in the streets now. She'll let you know, don't come for her if you ain't ready. This is old school right here. Yes, nothing wrong with it. Even when I asked her to help out on the campaign, because she obviously had some political chops, she was like, as long as it don't take away from sickle cell. And that's what she meant. So listen, Turn Left, I appreciate you guys. I am working on some fantastic guests. Thank you, Sabae Martin, for coming on and talking to us today about, I know it's over, right?
Yeah, I know.
This hour goes by fast.
We'll do it again.
Absolutely.
Because September is Sickle Cell Month.
Oh, then that means we need to have you back in September. We'll talk about it. Talk about some of the. We'll find out what your progress was from your fundraisers.
Be happy to.
All right, yes. So we know, and then you'll be able to tell us what those funds were being used for. You'll be able to share with us how we use those funds. I love it.
We'll be able to talk about how it was affected or not affected by what's happening with the medical.
Absolutely, we'll be able to bring all of that in together. Bring all of that in together. All right, I'm working on some fantastic guests. We're going to have more conversations. Education, is big. I'm still mad about SB 309 and the solar panel and alternative energy. I won't stop talking about that. You need to make sure everybody knows that, $20,000 will buy you a bill in the State House. 20 grand.
A month?
All you need. No, not even a month, Clint. Just one time. If you donate $20,000 to the right politician in our State House,
really,
that'll get you a bill passed that says that you own the sun.
Oh,
yeah.
Wow.
Yeah, 20 grand. 20 grand. He didn't even need it. That's it. I'm always going to be talking about that kind of stuff. If you have any suggestions on what we could do on the show, feel free to reach out to me, inbox me, let me know. Indiana's Own, hit me up on email, dana@indianazone.com. This is Turn Left. Shout out to Radio1.tv for allowing us to have this opportunity to share this information. HB, the boss is the truth. All community, all the time. Make sure you check out all the rest of his shows. In the meantime, I'll catch y'all next week. Thank you, Sabae.
Thanks, Dana.
Holla at the people. Turn left, y'all.